is typically the time where you should take extra care of your skin and avoid sun exposure.
For me, I don't do it routinely because we know steroid can thin down the skin of the face.
And these are the treatment that you mentioned is actually the lunchtime treatment. The people always go during lunch and do it and then go out without any downtime.
Hi everyone, I'm Dr. Peter, consultant dermatologist from Peter Chen Clinic.
Hi, I'm Dr. Loo.
Hi, I'm Dr. Chai.
So today we're going to talk about a very interesting topic. It's about downtime. Because a lot of patients will be afraid of doing any of the procedures, whether injectables or whether devices, because they are afraid of the downtime. So Dr. Chai, can you explain about downtime?
One of the most common questions that we receive from patients who are interested in aesthetic procedures is, how much downtime would I have? So what is downtime? So downtime is not necessarily the time that you need to spend on bed at home. It's typically the time where you should take extra care of your skin and avoid sun exposure. Downtime is crucial because it allows your skin to go through its natural healing process, which involves inflammations, and cell regeneration, and also collagen production. So all these are necessary for your skin to achieve optimal results from the treatment and also minimize potential complications such as scarring and also infection. And downtime can involve anything from redness, swelling, to peeling and flaking, depending on the intensity of the treatment that you have and also the degree of the skin disruption.
I think the downtime also depends on what procedure you did, whether it's non-invasive or invasive. Either device or injectable, we still got non-invasive and invasive as well. For non-invasive, it's definitely most of the time no downtime, most of the time. But also if there is, it's very minimum. But if let's say there's a minimally invasive, there will be a little bit of downtime. But also like Dr. Chai said, it depends on the intensity of the procedure you've done. If you do a radio frequency, you can set it very high, then you get a longer downtime. You set very low, then you get a lower downtime.
And during downtime, your skin will be more sensitive to touch or UV exposure. That's why it's very important to avoid activities that could potentially further irritate your skin.
Yeah, even when they wash face, sometimes they feel that it's very sensitive. So all those post-procedure care, we need to advise patients.
Yeah, that's why I usually advise my patient after any procedure, use a gentle cleanser, moisturize your skin well, and avoid sun exposure, wear a sunscreen if you need to go out in the sun, and also in general avoid touching the treated area excessively, and look out for those signs and look out for those unusual signs.
Yeah.
So basically the injectables, whether toxin or skin boosters or the fillers, right? Like for toxins, definitely we tell the patients no downtime, right? Because that very tiny little dot you can't even see. Unless you really prick a small little vessels, then you may have a little bit of bruise there. Very rarely it happens. And with any bruise, you know within a week it will go away. Right? Unless the patient is on some anticoagulant, some blood thinner, then it may last a bit longer. Now, whereas for skin boosters, again, also generally they will subside within the next few days. Even the hardest, the skin boosters, right? It will, after a few days, it will just blend into the rest of the skin. Like calcium hydroxyapatite also. It will not last for weeks or months. Now, on the other hand, devices, mainly those, like for example, lasers. There are so many types of lasers, right? Some lasers, we call it ablative lasers. That means they remove the surface of the skin. Right? When they touch the surface of the skin, you'll find that there will be scabs on the surface of the skin. And normally nowadays with the fractional technology just means that when the lasers are being fired, there are areas of normal skin in between the laser beams, so the recovery is much faster. So most of them will be within a week. The redness, the scab will just peel off nicely. Whereas there are non-ablative lasers. Non-ablative lasers, that means you don't touch the surface of the skin at all. It just directly go into the middle layer of the skin we call dermis. So for those, totally no downtime. It just appear redness. The next day the redness will be gone. So it really depends on what kind of lasers, what kind of setting you're using. So talk to your doctor, always, and find out what devices they are using exactly and what is the downtime.
And these are the treatment that you mentioned is actually the lunchtime treatment. The people always go during lunch and do it and then go out without any downtime.
Actually, they have some advanced products or the treatments that can help to speed up the recovery, speed up the downtime. So for example, talking about laser resurfacing, we can incorporate platelet-rich plasma or exosomes after laser resurfacing treatment because this promotes tissue healing. So it will speed up the recovery process. And like LED light, okay, we help to reduce inflammation as well. Antibacterial ointment can also help to reduce the risk of infections.
Some advocate to use steroid cream immediately after lasers. For me, I don't do it routinely because we know steroid can thin down the skin of the face. So I only use it for ablative lasers. When you see that the face is very red, then perhaps you want to just use it for 1 to 2 days to reduce the excessive inflammation that's been caused by the face.
I recommend my patient to use skincare with more advanced ingredients like antioxidants, vitamin C, or hyaluronic acid to support skin healing during the recovery process.
Now, for fillers, right? We know that fillers, if you inject it in the wrong area, it can be a very dangerous thing. It can cause blindness, it can cause stroke, So what are the signs to look out for to tell you that, something is not right already?
Yeah, usually after the filler, we must make sure that patient go back. Usually we need to see the patient immediately after, observe the patient a little bit after the injection before we letting them to go back. So some of the acute signs can actually appear immediately, especially the skin necrosis. Sometimes they have like white patches on the area. That means the artery is being blocked. So that one we need to dissolve the filler as soon as possible or refer to necessary department depending on the area.
So the blanching effect, as injector, when we inject, if we start seeing blanching, that means most likely you are injecting into the vessels. And also you have to talk to your patients as well. If patient feel uncomfortable, like even a bit of headache, I feel like there's pain somewhere, those are the early signs that it could be in the vessels. And the worst is, of course, then the patient tell you the vision loss. And of course, there is also possibility of allergic reaction. Patient can have what we call angioedema, eye swelling, lip swelling, all this. So we must know how to manage these complications if it happens. It cannot be just inject. I just know how, everyone knows how to inject, right? But where to inject safely, and if it really, really happens, how to solve the problem also is very important. Then those are the acute. But we know that there is also potentially the long-term side effect of fillers. That means from weeks to months to even years, we can still have this, what we call a granuloma formation. Granuloma means, right, your body recognizes that there is a foreign body there and wants to reject the foreign body. It produces all this antibody, send all the soldiers to surround, but it can't eat up the foreign body. So it remains dead. It becomes lumps and bumps and it's inflamed. And again, those we need to know how to manage it. There are ways to manage all these granulomatous formation. So if you are concerned about this post-procedure downtime, talk to your doctors about it. Obviously, you don't want to be doing the procedures that has a long downtime before an important function, before your wedding. Thank you.